Welcome to the HIT Podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As always, we are dropping into your feed on a weekly basis, coming in on Tuesdays with what I hope are well-curated, digestible, bite-sized, just really interesting conversations going on in this space. This week's episode will be absolutely no exception. So without any further ado, let me get right into it. This week's episode is brought to you by Montage Insurance Solutions. And without any further ado, I have my dear friend Elvira. Elvira, how are you?
I am delighted to be here. Thank you for having me and
have
having Cigna today.
Yes, thank you for being on. Thank you for being here. And just to dive into it, I'm super excited about this kind of wellness series conversation sort of thing. And let's just kind of orient the audience to sort of who you are, how you find yourself in the chair, and give me kind of the broad strokes of your career.
Sure. So again, thank you for having us here today, and really happy that Cigna's been invited. I've been in the healthcare field for quite a bit. I was with a prior carrier for quite a bit, and in the health and wellness role, as well as a provider role. So I was actually, on hands-on working with patients, and then also really working on the health and wellness tools. And now with Cigna, I've been with Cigna for about 5 years, and I'm a health engagement manager here in the Southern California area. So really excited to be here.
There might be people that don't even know, like, a health engagement wellness, what? Like, what is that job?
Yeah, I totally get it. Yeah, because you hear a lot of names and like, what is that person doing? So a health engagement manager or health engagement is wellness. People use that term kind of interchangeably. So when you hear wellness, health engagement pretty much means the same thing. And that's really working with clients and employees to make sure that they are taking full advantage of their carrier benefits, but then beyond, really trying to drive a healthy behavior for those employees so they are, achieving the optimal health and well-being. So our health engagement team helps partner up with the client and directly work with employees to stay healthy. When you say
client, you mean employers that have Cigna?
Correct. Yeah,
specifically for the medical?
Well, yes, exactly. We have our health and wellness tools are available to our different lines that we offer, but specifically most people think traditionally our medical line. Yeah,
and so when an employer has Cigna for their medical employer insurance, or they're considering Cigna and they want to hear sort of what you guys bring to the table, it's interesting to know, someone's job is to figure out who the Cigna clients are, what you guys can do from a wellness standpoint, how to kind of bridge that gap. If we can sort of play proxy in this conversation here, what are some of the tools you bring to the table? Let's say I'm an HR person that has Cigna and I want to know, what can you do for me?
Right. Well, we can do a lot. So first and foremost, Cigna's mission is to improve the health and vitality of those we serve. So with that focus, when we're talking about health and wellness, as an HR team, you're going to have a health engagement team. You're going to have a professional that's experienced and passionate about health and wellness. So this team is working with you not just on day one when you are partnering with us as an employer, but year after year. So we'll get to know your employees. We'll get to see a whole person approach in terms of, let's just say you're interested in having an exercise program. Maybe you're hearing from your employees that they're interested in mental well-being. So your health engagement team is going to leverage the health and wellness tools to drive that engagement, to specifically make sure that they're tapping into I Prevail, Happify, which are apps that we offer to our members. Or maybe they're interested in doing a fitness challenge through our partnership with Version Pulse, which is available to our employers and our customers. So your health engagement team member is really the liaison between making sure that your employees are informed about these benefits, and actually if they need to learn a little bit more, we're hands-on in doing demos, coming on site, doing education, and helping promote that program so they're more engaged.
So I'm hearing a lot of programs, and I love that because it gives me this idea that Cigna brings a lot to the table if I'm unfamiliar with what some of these names mean, right? So when you talk about, okay, maybe my employees do come to me and they do want to do an emotional well-being campaign. Let's throw some red meat at it when you talk about Happify or whatever other apps you're talking about. literally, what does that look like? What do they do? What do they bring to the table?
So, for example, we'll do, first and foremost, with the employer, we're going to do an organizational assessment. So first is we have to understand your population. This is not a cookie cutter approach. We'll do an organizational assessment, just a series of questions with the HR person. And then based on that assessment, we're going to say, okay, we see that you're doing really well on emotional well-being, but maybe you need to do some more on fitness. So they may decide that they're going to incentivize their employees through the Virgin Pulse digital experience. So we can help work with the employer in setting that up. Let's just say the employer says, no, we want to do something on mental well-being. So May Mental Health Month, that's a national observation. So that might mean that we are bringing on site an educator to focus on mindfulness. It could be on site, virtually, or a combination of that. So your health engagement team member is helping set that up. Let's just say towards the end of the year, they're really interested in preventative care. So they want to make sure their employees are getting their flu shots and biometrics. So Cigna will work with you to set up those events on site if you want to make it like a health fair to make it fun and interactive. So that gives you a snapshot of how we're listening to the employer and their specific needs, and then bringing in the different health and wellness tools to actually make that a reality and bring it to life.
So I get that there's a lot of customization. I appreciate that. And I get that there's even some kind of on the ground events. And even as you said, they can be virtual, they can be in person, they can be a combination because different employers have different looks. I think I heard you say the term, is it Virgin Pulse a couple times now? If someone's not familiar, what do they do? When you say I bring you this tool, why? What is this tool? What does it do for my members?
Yeah, so that's our lead wellness solution. So if you're new to us or you're renewing with us as an employer, all of your customers are going to have access to that experience. It's a digital experience. So when they're logged into when they log into the MyCigna portal, so let's just say they're reviewing their EOB, their explanation of benefits, they're looking at a claim, they're looking at a provider. All they have to do is click on wellness, and that'll take them to Virgin Pulse. And this is a digital experience to drive engagement. So they'll be able to get some content on a specific health topic that they're interested in. They'll be able to participate in health journeys. So maybe I want to work on my sleep, and I'll be able to work on that. And I can use my device, whether it's my computer, my laptop, if it's my tablet or my phone, they don't have to sign on differently to have this experience. And what we know, the reason why we partnered with Virgin Pulse to drive this type of engagement in terms of the health and wellness area is that we know when we have an engaged audience, they're more productive, they have lower levels of stress, lower levels of absenteeism, and lower medical costs.
So I actually almost heard you at the beginning of this talk about the entry point that Cigna has, whether it's your website or an app, right? So maybe even backing me up, as a new member to Cigna, I can go to the MyCigna portal on my desktop, also an app. Is that right?
Yeah, for sure. It's like a one-stop shop. It's like we know that you're a very busy person in terms of your role as HR, right? If that's the role we're playing today. But all of us are really busy. So yes, Cigna has an app. MyCigna. On day one, you register, and everything you need in terms of your health and wellness benefits is available there, and you can download it and have it on your phone.
So we are talking a little bit about wellness, and we'll foray right back into that. But you've mentioned like the healthcare, for example, so they can find their EOB or explanation of benefits, book a doctor. They can sort of look at their utilization and claims activity in this portal, right?
Yeah, and beyond. I mean, they can actually do it, use our cost estimator tool. So let's just say they have a new medication or they're going to have a procedure coming up. They can actually search to see in network providers and see what the projected cost is so they can better navigate how they're going to manage that with their family budget. They can also look up their behavioral health providers. And so now we've expanded our virtual care capacity. I know that out of COVID, I mean, that was a big need across the board. People were needing more care in a more convenient way. So MyCigna is that main one-stop shop where they can secure their services that they may need, whether it's behavioral health, virtual care, dermatology, things like that. So again, not needing to go to a different site to do that.
And then so inside of this place is also where you've got your wellness sort of tabs and tiles, and that's where they dive in. You mentioned Virgin Pulse, and so some of this stuff is tied to you guys meeting with the employer, you talking about almost an education campaign. So, hey guys, get the app, get into it, click on it. We also talked about a couple of other vendors, and I want to know if you can tell me about the members' experience with any of the other vendors you have on the maybe mental health care side or emotional space. So For example, again, we touched on like a Happify, wherever that question kind of makes you want to go.
Yeah, sure. So I mentioned Happify and iPrevail because these are free apps are available to our customers. So they can utilize it however they want at their leisure. And it's really focused on stress management and mindfulness. Now, if someone wants to do a deeper dive in terms of their mental health well-being, again, they can search their in-network providers, and within the virtual provider network in terms of behavioral health, we have other expanding providers. So I would say a lot of people are familiar with Talkspace. I know that we had a famous Olympian that was a spokesperson for specifically that provider network. So if someone wants to access behavioral health and they're comfortable within the texting space, that's considered an in-network provider for our customers. So there are many more. I know that we we're not going to be here for extensive time, but so that gives you an idea of how our customers can access behavioral health support, both virtually, in person, or based on what they need at that time. So they may have some visits that are virtually, and then maybe brick and mortar.
Yeah, and even like you said, text messages, right?
Exactly.
Okay, so then a lot of this is driven through the wellness, which is inside of the app. Your job, your whole job is to get out there and make sure employers are aware of this, that have Cigna. This rolls out to the employees. Do you have some like best practices or tips and tricks, or when you see this done well, when you're sitting in the room, so this is a virtual visit with Elvira right now in the room, what would you tell employers that are interested in, promulgating some of this stuff?
I think the first thing is that it's a journey, and so you're not there alone, right? And you don't have to have all the answers when it comes to health and wellness, and that's why our health engagement team and Cigna's approach is a team approach. It has to be top down usually, meaning if you just have a couple of individuals who will make those key decisions in your company and not everyone's necessarily on board, that's okay, but it makes it a little bit more challenging to actually deliver some of these strategies and get really the needle moving to make sure that your employees are healthy, right? So again, if you're needing a little bit more support in how to understand and really get everyone on board internally at your company, we're there with you. Your health engagement team will be able to leverage that conversation. So again, I think it really needs to be top down, making sure that we have clear understanding and commitment, and understanding that it takes a lot of work, but again, you're not alone in that journey, and you have a whole team behind you in developing your wellness program and actually delivering it year after year.
Yeah. So I think that this is, we've talked about a lot of different things. I'm curious, my questions have sort of been driving this a little bit. Is there anything that I haven't asked about, or that you're like, I would really like to touch on this?
Yeah, no, that's great. So I would say to continue on terms of like what you need to be aware of in terms of making sure you're really improving the health and vitality of your customers and your employees in partnership with Cigna, is that we use data. We use research. We've done research in terms of loneliness, especially coming out of COVID. We know that people are isolated, and if someone is feeling lonely, that has a negative impact on their mental health. Yeah. We also did research on vitality, and we know that people who have high vitality, they have better health outcomes.
What do you mean by vitality? Does that mean something specific to you guys?
Yeah, so yes, it's a new generation measurement of whole person health. So we're looking at health, energy, and strength. So you might be a healthy person, but if you have low energy and something else is impacting, then you may not have the most ideal health outcomes. Sure. So we're leveraging that research. We're also leveraging the data in terms of claims, right? So we're able to look at, hey, how's this client doing in terms of preventative care? And let's just say their annual checkups are pretty low. We will leverage that data and working with the client and saying, here is an opportunity. Yeah. So again, we're always utilizing data to drive that engagement in addition to complementing with all our health and wellness resources. I
love it. Well, that is mainly the stuff I was hoping to get into. Any final words, or are we just getting out of here?
Well, I really enjoyed this conversation. I could talk forever, so I'm so glad that we're cutting it off at some point. What I would say is, again, that Cigna's mission is to really improve the health and vitality of those we serve. As you can see, we have a passionate team approach to that. Yeah. We know it's fluid. It can change from day to day. And the client and employees, our customers, are not alone in that journey. And we also know that there are, emerging topics right around the corners, like GLP-1s. We know that a lot of people are really interested.
Those Ozempics of the world type of a thing.
Yeah, there's a lot of questions out there. And so we're hoping that we get invited back to continue that conversation, and we can dig a little deeper on these kind of hot topics. So we're here to partner with you as well to better educate those of you out there who may have questions.
I think that's why I try to have these conversations in front of cameras. And God bless you for doing this, because I do think it's important. And in my day job as a benefits consultant, we have the carriers coming in often and talking about these sorts of things to us. And the idea is, well, we'll educate you, and then you can go educate the clients, and hopefully they can go educate their employees. And I'm like, man, if we can get some of this stuff kind of direct here, and we have these conversations a little more out in the open, I think it helps expose for not only the Cigna clients, what Cigna does specifically, but the idea that regardless of who you are as a member, an employee, you should talk to your employer about what healthcare provider do we have, what do they offer. And I'm using, by way of example with Cigna, a information campaign that the carriers are generally speaking quite interested in this stuff and often have cool tools. And I'm glad that you're helping shine a light on it, because a lot of times some folks might not always know about all these great tools. Right. So I appreciate your job, your role, you coming out, all the above.
We appreciate you back. Thank you for having me and Cigna today.
Awesome. Well, that's all the time we have for you this week on the podcast. Join us next week. Join us every week. Until next week, make this the best week yet. We want to get out by thanking our sponsors, TrueHue, and thank you guys, and thank you, Cigna.
Appreciate it.
Appreciate it. Take care, guys.